Silvia Subirana, welcome back. Our second time to try record this. It's good to see you again.
Hi, it's good to see you too. I'm excited to be here and hopefully this works and everything is good.
Oh, yeah, don't jinx us, because last time we had a great conversation, but it got lost. Um, welcome back. And we're going to be discussing alcohol and a company that you work for, which is called Unconscious Moderation, which is the whole idea of this is why I wanted to speak to you again. I see this as a problem in not just my clients and followers, but society, and I'm sure you do too. We'll get into that. But first, you're a clinical psychologist. Why did you get involved in this area of addiction and alcohol specifically?
So I haven't drunk in around 6 years, because it didn't sit well in my stomach. I had loads of gut issues that just, they showed me that my body was not, my body didn't want alcohol. It was just rejecting it all the time. So for me, it didn't make sense to continue forcing it. And then I realized when I stopped drinking that I hadn't actually made a conscious choice to start drinking. You just do because everybody else is doing in your teenage years. So that's when I realized that I wanted to help people feel what I was feeling and let them know that there's nothing wrong with actually doing what feels better for you. And you're not going to be the weird one because more and more people are accepting it and are exploring these other alternatives like mocktails or non-alcoholic wines and non-alcoholic spirits and all these things. So I think the world is getting better at these things, at giving more options to people because I remember 6 years ago there was pretty much no mocktails, and now you have so many options. Sometimes the mocktail list is even longer than the cocktail list. So it's very, very exciting to see where the world is going.
Mm. So you mentioned your body was rejecting it and the gastric distress, and we spoke about this before. And I do consume alcohol, not a lot. I know everyone says not a lot, but probably one or two drinks every third weekend or something like that. Like it really is not a lot. But even then, I will feel it everywhere, but especially in
Mhm.
my gut, a lot of gut inflammation. And I know this is not your area of specialty, but I'll give in my tidbits as we're going along to further kind of help people have context that when you have gut inflammation, a lot of people think, well, the hangover, the mental health issue, yeah, that's a factor. But when you've gut inflammation, that will in itself create endotoxins, which will directly affect mental health. So then people feel almost depressed, malaise, they don't like each other. That like the list goes on and it can get worse and worse because people will then start to think that they have a genuine mental health issue like depression, and then they go to their doctor and then they go and get put on an antidepressant of some sort, and then that has side effects, and then you can see where this vicious cycle is when the whole time maybe you were drinking too much.
Definitely. And a lot of people say that the gut is a second brain because there's so many neurotransmitters being segregated from there. Then it really affects, like, if you're stressed, if you feel anxious, the everything affects the gut. Is very, very important to keep it balanced. And yeah, definitely alcohol makes it very inflamed and breaks with that balance. And you actually made a very good point because when I was having all those gut issues, I remember I started having loads of acne, and I've never had that painful acne here in my cheeks. So it was new, and I was in my 20s, and I was like, I didn't have this when I was a teenager. Why is it coming now? And I went to the dermatologist, and they said, you need to take Accutane. But I was like, I'm not feeling well. Like, I know that I'm inflamed. I know that something's wrong. I don't want to take Accutane because it has so many side effects that I know that I'm going to feel worse. And thank God I didn't take that. And I kept digging until I found all those gut issues. Because if I had taken that Accutane, my problem would have been so much worse. So um, that's why it's so important to have a look at the whole body and doing it holistically and understanding that everything has an impact on everything, right? We cannot separate the different parts of the body because mental health, it can be because of something that happened, like, I don't know, you're grieving something or many, many different things, but it can also come from the inside, like your gut is not working well, or there's something that needs to be checked.
Hmm. Two things there with the Accutane. It could have got worse in the context that you're saying with the side effects. Or it could have got worse that you took it and it cleared up your acne. So then you wouldn't have recognized the alcohol was a contributing factor and you would have kept with the alcohol. But the other thing is, not a lot of people know this, and I know we kind of touched on this before, but this is more my area that when women do get cystic acne, it's generally going to be an indication that you have a liver issue and there's some estrogen issues going on there. And we detoxify most of our estrogen through our guts. So, one, if you're having gut issues, that's going to be a problem. But we also break down and metabolize estrogen in the liver. So, if your liver's dealing with all this alcohol, that estrogen is just getting backed up and backed up and backed up. And I do, if you don't mind, I just want to throw in a story of a client of mine that
Hmm.
started with me, and I don't think we discussed this before. She started with me in January, and one of her biggest complaints was very heavy periods, like very heavy, so much so that she was bleeding for 2 weeks of the month, which is not normal. And her alternative, so she's in mid 40s, and her alternative offered to her by her doctors is a hysterectomy. And I'm like, that seems a bit extreme. Like you're mid 40s? Why? Like she's like, because they can't think of anything else. There's no other option. So I was like, well, how about this? So this was the one thing that I picked up was she was having almost a bottle of red wine every evening to de-stress. Super common. A lot of women do it. And I was like, how about this? You give me a month. We're going to eliminate the wine, and I bet you we can save your uterus and your cycle will become normal again. Well, within 4 to 6 weeks, and she was still having some wine at the weekend. We had just eliminated all the rest. Within that time frame, period back to normal. Not even shorter and regular, but a normal flow as well. And she's like, how is that? And I'm like, because if you're bombarding your liver and your gut with alcohol pretty much non-stop by the time it gets metabolized, you just if you're drinking a half a bottle of wine, a bottle of wine at night, you just always have alcohol in your system. You probably shouldn't drive either, but then you don't, they're not getting a break. So all it this estrogen was backing up in her body because when your body sees alcohol, it's a poison. So its primary objective is to keep you alive. So it's got to metabolize the poison. So it's busy dealing with all of this alcohol all day, every day. And the estrogen just kept backing up and backing up. So then when she was due her period, it just gushed. It just flowed because the body was like, yay, this is my opportunity to get all this estrogen out. Like you almost feel sorry for the body at that stage. It's trying to keep you alive, it's trying to keep you well, and it's doing its best. So, like, that's how much it influences, especially a woman's body. So there's my story.
Yeah, definitely. It's very, very inspiring to hear stories like that because then I think more people will realize that maybe the habits that they're having are not as healthy as they thought, and they're drinking more alcohol than uh, they think that it's healthy, quote unquote, which is there's not really a healthy amount of alcohol to have, but obviously the least you take, the less benefits you'll see. Um, so if you are drinking too much, maybe you don't identify that those symptoms are related to this because alcohol is so normalized. It's not seen like any other drug. So if you, I don't know, um, like if you do cocaine or other type of drugs, you know there's a component that it's telling you that because it's illegal, then it has that label of it's bad for you. But because alcohol is legal, it doesn't have that label. So everybody is sort of having alcohol in any aspect, in any setting, sometimes even in the workplace. And it's so normalized. You see it in movies, you see it everywhere. So yes, we know that it's not healthy, but because it's legal and it's so normalized, we still do it and we don't realize all the effects that it has in the body.
Well, that goes to the unconscious aspect of the
Hmm.
company's name is like I grew up in Dublin, you grew up in Spain, in Europe. It's not even a thing. You don't think of it. It's not a thing. You just hit a
No.
certain age and yay, I can drink. Like it's just all part of growing up. It's part of becoming an adult now. I can drink and there we don't, we'll have sex education in school, but we don't have alcohol education like this is a choice. It's a choice for you to have sex if you want to, but be aware of all the side effects. But we don't have a conversation like just because you're of age now that you can have alcohol doesn't mean you have to. We should have a separate alcohol class now that I think of it. But it's so
We
unconscious.
In Spain we have it, but it's not very effective because it's one day. So you have a 4 hour lecture in alcohol, and yeah, you learn, but people are not really listening to it because what is cool is to do what everybody does, which is drink, right? So I don't know if it comes from high school and to improve the education, or if it's just more of like a social thing in general, that people need to understand the consequences and the effects of substances in general. I'm not sure if it would be beneficial to, I don't know, do different campaigns where there are campaigns out there. I'm not really sure how it would be better. However, I do see the sober curious movement starting to get bigger, and more people are um, not following those norms that probably we grew up with, that was like, okay, you get to a certain age and everybody drinks. There's no other option. And the one that is not drinking is the weird one. I believe that this is changing, and that is actually very interesting, because I think that it happened sort of the same with tobacco, that I don't know, 50 years ago or 40 years ago, everybody would smoke everywhere. And now it's just in outside, and in certain areas outside you cannot even smoke. So I think it's becoming way less common. People still smoke, of course, but I think with alcohol it would sort of be the same, or I hope so at least.
I think at the very least, the moderation conversation needs to be had. There's
Hmm.
a lot of talk about alcohol, and the research around alcohol is kind of blown up over the last 6 to 12 months. The big names, Dr. Andrew Huberman's talking about it, Dr. Andy Galpin, and then of course the female doctors. Like everyone's talking about it now, but theirs is the full on like, okay, we all agree no amount of alcohol is good for you. Like it's ethanol, it's poison. Of course it's not. But there is context to be had, I think, on individual basis, whether or not people want to just completely give it up or they understand, okay, maybe I've been drinking too much. Then we can reflect on why have I been drinking too much? Do you feel you need it because of stress and it helps you wind down at the end of the day? Because that's a problem right there. And then maybe you are someone who needs to look at the moderation aspect. If you're not willing to go completely cold turkey, which, like you mentioned at the start, a lot of people are not. They hear what all these doctors and experts are saying, and they're like, yeah, okay, I hear you, but I'm not willing to do it. That's where
Hmm.
the moderation comes in.
Exactly. And that's why I always encourage people to try different things, to try tools, to um go into, I don't know, these months, for example, dry January, sober October, these things, to try them, because just by stopping to drink for 30 days gives a very, very good reset for the body because, as you said, it just calms everything down and all the hormones and everything can finally have the process, the processes that they sort of need to do, right? Instead of being focused on getting rid of the toxins. But also, I always encourage people to look further, even if they feel like they don't have a problem. It's always good to revise the habits that you have and how everything is affecting you and not live in survival mode because or automatic mode because when you live in automatic mode, that's when you miss stuff that's going on and you are not listening to what your body's telling you. And sometimes, as for example, compared to the woman that you were talking about before, those periods where her body screaming that something was going wrong.
Mhm.
So when we live in automatic, we just don't take care of those symptoms, and that's what actually gets that's what the symptoms actually get worse and worse. So that's why I encourage people to check out, for example, our app, Unconscious Moderation, or many other programs, many other apps to be curious about different things and to see how people are having different habits and different options because again, we are given as a society that we should drink in these settings. But why? Like, we don't question why. We don't question why, if I go to a bar, I have to have a spirit or I have to have a beer or something like that. Why can't I have a soda without people thinking that I'm weird, right? So, starting to question these things, even if you don't feel the effects of alcohol, is a very interesting way of getting to know yourself and your body better.
I think if you don't mind, let's talk about this for a minute, what we mentioned with that client of mine. Why was she having alcohol in the evening? Well, because she felt she needed it. She felt it helped her relax in the evening and wind down after the kids went to bed. And that was her me time as well. You probably don't hear it as much as me, maybe you do, but this is like is so common. I wouldn't even say every second woman says this, nearly every woman. Not that they're drinking, but the evening is their me time. And I get it. I
Hmm.
have two kids and a husband too. Like, I get it. But you need to do better with what you're doing in your me time. But a big factor of this, and I think there's a lot to be considered, and I'd love kind of your input on this as a psychologist. We've got like the hustle and bustle of life nowadays. We're just go, go, go all the time. Then women are expected to have careers and then come home and take the house. And men are, of course, because I primarily deal with women, we're just focusing on women, but men are included. And now we know it takes two people to pay a mortgage most of the time, and then have kids, and then come home and do the laundry and clean and get the kids to bed and wash. And it just keeps going and going and going. And you're exhausted by the end of the day, which nobody can deny. We're exhausted by the end of the day. We were joking that you haven't got kids yet, but wait till you do, because it all changes then. But so then we would be negligible to not mention there is a huge hormonal stress hormone component to this. People are exhausted. Then you've got everything going on in politics, and you're in Spain now, but on this side of the world, of course, we've got the tariffs and the Trump and then the gender movement, and there's just so much going on. So that's stressing people. And it's just, even with food habits, generally we can trace it back. There's some sort of stress or hormonal issue, usually triggered by stress, or like emotional trauma issue that's causing people more so now, like in the age group that I work with, mid 30s, 40s, 50s, to use alcohol. And I'll add in when we were younger, teenagers, early 20s, we weren't necessarily using it to soothe our stress or exhaustion. We were
No.
using it for fun. It was like fun, let's go party, let's go to the rave. But in the 30s, 40s, 50s, we're using alcohol differently, and it is definitely, I'd love to hear your opinion. In my opinion, stress and tiredness, huge, huge factor.
Definitely. I think that we live in a world that is very stressful, that we have so many inputs, so many things going on. As you said, all the list of worries and everything. And that is a normal day, quote unquote. What if, I don't know, something goes wrong with the day? Someone has an accident, there's something that breaks and you need someone to repair it. Like there's many, many things that can happen that also add up more stress to those days that are already very stressful. So I believe that the world nowadays is not built to help us relax and to have that time for us, because we don't have the time. We don't have hours in the day. Many people that I work with, they say I need the day to be like 30 hours long instead of 24, and I'm like, well, that's not possible. So you actually need to work on the priorities and how to um work, like organize your time. And I know that for some people that is extremely difficult because the wages are not great and everything is so expensive. And this is just more stress that gets added into our daily lives and our mental health. It gets very impacted. So first, I believe that we don't have the tools to deal with that stress because we're surrounded by all these inputs, but then nobody teaches us how to actually deal with these unless you go to therapy and you learn. But because everything is so stressful, it takes time for you to learn and to actually work on tools and apply the tools and to see the changes, right? So, um, we live also in a very impatient world, and many people don't actually have the patience to wait and actually work on those tools and see the changes that they can have, because it's not immediately. And in Spain and in many countries, we're having problem with, for example, antidepressants, because people are they go to therapy, they see that obviously it takes time to get better, to work on mental health. And I'm not denying the use for antidepressants, because I believe that in some situations they are very helpful. And I've seen people, like some of the people that I've worked with, that they've had antidepressants for 6 months or a year, and it has completely changed everything and it has really helped them. But then you see people that have been taking antidepressants for 15 years, and instead of, for example, the alcohol, there's also the antidepressants. Um, and they use it as a way of feeling better. And again, that is not a coping mechanism. That is not a healthy coping mechanism. But both alcohol, antidepressants, and other substances give you that numb you and make you feel better. And you don't need to address those feelings and those emotions that are make you feel that pain and that stress. So it feels, in the short term, it feels easier, even though in the long term, it has way worse effects. And you don't realize that you're going actually like lower and lower, and eventually you're gonna it will take you way more time to get from there if you don't address it.
Yeah, it's a fool's errand, as we say in Ireland. You're kidding yourself. You might be masking the problem because nobody can deny, just like chocolate, a glass of
Hmm.
wine or whatever you like, margarita, a load of chocolate. In that short term, if you're stressed, it does make you feel better. It does. But then thinking of the ripple effect, that long-term effect, and what if I do keep doing this regularly? And just for people to understand, in the context of regularly, we're not only talking about what I said with my client every night, we're talking as well about every weekend. Like that,
Hmm.
in my opinion, that's still too much. So some people, like what I'm referring to is, let's say you have drinks every Saturday night. I personally don't think that's a good idea. I'm in health. I know it stops fat burning. It dysregulates hormones, especially during perimenopause. It causes erectile dysfunction. We mentioned the mental health issues, skin issues. There's a lot of issues there. But some people are having a drink Friday, Saturday, and maybe a cocktail with brunch on Sunday, and they don't see the harm in that. And there's a lot of harm there. So, what can we do to help them? A lot of people are not going to go cold turkey. That's where moderation comes in.
Yeah, and I always say that actually completely quitting is way easier than moderation because when you don't have a choice, when you tell yourself, I'm not going to drink, then obviously you don't have that temptation because you don't see it as an option. You don't contemplate it. Whereas with moderation, it's very easy to go back to old habits like I'm gonna drink Friday, Saturday, and Sunday, as you said. So that's why it's very, very important that people that practice moderation are very conscious of the reason why they're drinking. And that's something that we work from like with when people start doing our program is why are you drinking? Where is this coming from? Is it because you actually want that drink? Or is it because you're stressed and you want to numb your emotions and disconnect? Or
Or
you
there's
are
a
feeling the
weakness.
pressure?
I don't mean to cut in, but this just resonated me with a different client. There's some sort of weakness around alcohol as well. They may not necessarily be stressed, but there's a weakness. Where is that weakness coming from? Like like you're correct. Like, why are you doing this?
There's many, many reasons why. And when I talk to people, everyone has their reasons. So it can be and like any reason that you want, it can be the reason why you're drinking. So I always talk to people and tell them if you visualize yourself with a drink that looks exactly like an alcohol beverage, like for example, a mocktail, as I was talking before, or a non-alcoholic beer, if you ask for that and nobody hears you, nobody knows, and you go to the table and you have that, will you feel comfortable? Will you feel empowered? Will you feel okay? Or will you actually crave the alcohol?
Mm,
And
good
a lot
point.
of people actually, what they crave is the fancy drink. They don't want to turn up to on a table with a glass of lemonade or with a glass of water. Like they just don't. They want the fancy experience. They want to be like everybody else. You don't want to
It's
stand
a
out.
social, yeah,
Exactly.
participation aspect, regardless of what's in the glass.
Exactly. Or everybody cheers and you have a glass of water and then a lot of people say, "Oh, it's unlucky. You don't cheer." And then you're out of the setting. So that's I think that's where a lot of people struggle and that's where I suggest that loads of people try to investigate and experiment with non-alcoholic beverages because there's so many options out there as I was saying before. When I stopped drinking, it was three options like lemonade and Coke and or normal water, and that's it, right? And there were no many options. Maybe non-alcoholic beer, but it's very very it's very bloating for me as well, so that was not an option. But now there's so many options out there that for people that are a bit more insecure and they don't want to stand out and they feel like they don't want to be the center of attention and they want to avoid people asking the questions, oh, you're not drinking, are you pregnant, or what is going on, are you ill, or which happens. It happens as a we imagine because I've been in that situation many, many times and it happens way less than we imagine. But I understand that that can be a fear that I work like a lot of people that I work with have. And I always suggest them to experiment with fancy drinks, fancy looking drinks that are non-alcoholic, because that makes you feel part of the experience. And then a lot of people realize that what they want is that they want to feel part of the group. They want to not stand out. And actually I've worked with people that have been ordering maybe as you said they used to drink during the weekend and they one of the days in the weekend, for example on Saturday, they switched to non-alcoholic drinks, or maybe they have one alcoholic drink and then one non-alcoholic, so they can start moderating that without anybody else knowing. And little by little, they feel more empowered and they see the benefits because, as you said before, when you start reducing it, even if it's not completely quitting, you see the benefits. So when weeks go past and they see the benefits, then they feel more empowered to actually say, yes, I am not drinking
It
or
gets
I'm drinking
easier.
less.
Yeah, it gets
Exactly.
easier. Just like, shall we say, diets or exercise, it gets easier. Like, that's such a good point that we hadn't mentioned before. And I hadn't even thought about that. Like, do you feel just as satisfied with a mocktail in your hands, participating in the group and the fun, Or do you actually feel you need the alcohol because you can't let go or wind down or relax because of stress? And if it is that one, well, there's your answer right there, that you should be looking at the stress problem there. And another thing you mentioned that I never thought of before was the kind of self-consciousness, the insecurity aspect of, I forget that sometimes because I'm quite confident myself from everything I went through when I was a teenager, like confidence is built. But so then I don't consider, like, I'll walk into a room and do whatever I want because I'm that sort of person. I don't care what other people think, but I never think that other people are worried about what other people are thinking of them. And you brought that up. It's the same when people go to the gym, they're like, is they're looking at me, everyone's judging me, and I'm like, no, no, nobody is. Like on it, I've been in the gym forever. We're all too busy doing our own thing. We're not sitting around looking at you. We don't care what you do. But people who are insecure, self-conscious, they think that. So in the context of the gym, I can see that. But I never saw it in what you just said, that in a bar or a party situation, that people are uncomfortable because they're thinking, oh my God, is she or are they judging me because I'm not like drinking alcohol? That's super interesting.
Yeah, and that's something that ironically I hear a lot. I hear a lot of people saying, I don't want to look like the weird one. I don't want to be like surrounded by people asking me questions. I just want to feel like everything is normal. So it is a big issue, but probably you don't hear it as much because if you don't struggle with it, these people don't actually share it or they don't want to let other people know that they're feeling like that. And then when they start taking care of themselves because they realize that their habits are just not sustainable for them, then they come to programs like My Dry 30 and then they start working and then this is one of the first things that they ask. So it really does depend on the person, but it's something that worries so many people. You'd be surprised.
Well, I suppose it does now that I reflect. I suppose based on the
Mm.
last decade of madness that's happened in the world, that
Mm.
more people are feeling insecure than ever and self-conscious. It would make sense, just something I never thought of before. You
Mhm.
mentioned the cold turkey, like, well, I used the term cold turkey and then you did, but completely quitting. For a lot of people, it is a good idea. Just quit. Doesn't mean everyone's
Mhm.
going to want to do it, but for a lot of people, it is a good idea. Just like if you're a cocaine addict, maybe you should quit, or benzodiazepines, or some people have to go cold turkey with chocolate, kind of like Lent. People can do it, it can be done. I think it's a good idea with what unconscious moderation is offering to go cold turkey for a month, like 30 days, and show yourself what you can do first. And then at the end of those 30 days, you reflect, do I want to keep going with this? Am I happier without alcohol? Do I feel better? Or do I feel now that I've shown myself I can control myself, so therefore I can control having one or two drinks every couple of weeks? I've
Mhm.
gone, I've done it many times where I've just not had alcohol for months at a time. I know I can do it. It's easy. That could be back to the confidence thing we were talking about. And then if I want alcohol, I know usually it's not going to be more than two or three. Like I can control myself there. But I do
Mhm.
think for most people, it is a good idea. And we know a lot of people can do it because a lot of people do give up stuff for Lent at least, that you give up for 30 days and
Mhm.
reassess the situation at the end.
And also, I think that it really, really depends on the person. You said, for example, for you, it's easy to moderate. But then I talk to so many people that they say that moderation is extremely hard because of what I said before, because you have to actually balance it out and say, okay, am I drinking too much? Am I like, you're always overthinking it sometimes when you're like, where is the line? Where am I gonna actually put the limit, right? Um, so that's why, for example, we give if after the 30 days someone chooses to completely quit, then you continue the program is 90 days, so you continue the rest 60 days of no alcohol, and then after that, obviously, the good thing would be if you continue like that and you implement all the tools that you've learned. But if you choose moderation, we give special tools that we don't give to people that are completely quitting, because these people, as I said before, they don't need those tools because they're not playing with the option. Whereas when you are moderating, you need to understand when when you want to drink, when you're not, and set your boundaries and your limits, which for so many people is very, very difficult. So that's why I think that it really depends on the person as well, because I've worked with people that they wanted moderation, and they first started the program with the idea of pursuing moderation, but some months after they said, this is just not for me, because again, I'm overthinking it. I'm not sure on when to drink, when not to drink. I would rather just not have the option and decide for myself. I just want to have a lemonade or a mocktail or a non-alcoholic beer or something like that. So I think it really depends on the person. And that's why the unconscious moderation program also focuses on helping people learn about themselves and understanding uh, how they work as a person. Because then when you know, I always say knowledge is power. So when you know what you want, when you need, and what you like, then you can make better decisions for yourself. And what might work for me might not work for you. And that is completely fine. So understanding that and learning about yourself is key to then break patterns and adapt your life like you want to live it.
It really is about learning about yourself. You're not learning about alcohol or anyone else. You're learning about yourself. And what
Mhm.
you're saying about moderation is so individualized. Like you're correct. One thing that like I say with my clients sometimes is like if you have this, are you opening Pandora's box? So I would think of, you remember the Pringles ads growing up, once you pop, you can't stop.
Yeah,
It's true. You can't just have one, whatever they put in it, you have to have the whole lot. And for some people, moderation, they have one chocolate or one drink. And before you know it, the whole box of chocolates is gone. I may be speaking about myself here. Or
me too.
there are 10 drinks in, oh, like I told you, in Canada, there's a chocolate company called Purdy's, and my family knows I love them, and I have to tell them don't buy them anymore. My husband will get me like a box for special occasions, and in my head, I'm like, I'll just have one. It's post-workout, I'll just have one, and then two, and then three. And then halfway through the box, I'm like, fuck it, I'm halfway through, let's just finish it. But for me, that's my Pandora's box. Like, I can't do moderation with that. I've learned that with myself. It either has to be all or nothing. You either have all the chocolates or just don't have them in the house. And the same, but for drink, it's not like that with me. I can have one and walk away and do something else. But for some people, that's that problem. They have that taste. You taste
hmm
one, then you want another. Before you know it, you're five drinks in. It is very individualized.
Definitely. And again, you have to adapt it to how you react. But to adapt it, you need to understand how you work. Because I am exactly like you. If I have 1 ounce of chocolate, you blink your eyes and I've finished the whole thing. So that's why I try to not buy chocolate, or only buy it in special moments or in specific occasions, because I know that that chocolate is going to last less than 1 day in my house, because that is just how I work. So if you know, like for example, if someone that loves wine, for example, knows that, and they learn that about themselves, then a good prompt is to avoid going to the bottle shop, because going to a bottle shop will trigger all these things, and then you won't know it and you will be finishing the whole bottle. So again, you need to adapt it to yourself, because that might happen to someone, but then to their partner, their sister, or whatever, it might not happen. So it's very, very personal, very individual.
So, in conscious moderation, you have a website which introduces people to the idea of moderation. And there's also an app that's free. And that can get the ball rolling, and it helps with daily habits and self-reflection. And you tell us more.
So the app, as I said, is 90 days, the program, and then you have 7 days for free to try it. And then if you want to continue, because we want people to understand how the app works and everything. And if you want to continue, you need to pay $30, 30 US dollars. Which again, we wanted to make it very affordable for everyone because there's so many programs out there that are very expensive and people actually cannot afford them. But $30, we thought that if you're not drinking for a month, you're actually saving money because that is money that you would easily spend in beers, wines, cocktails, because alcohol is so expensive nowadays that if you drink out, $30 only covers you two
Two.
drinks, maybe,
Yeah.
yeah, and that's it. So it's very, very accessible for people to have those $30 to actually pay for them. And then it's 30 minutes a day where you work with the unconscious mind and with a conscious mind. So we actually target the patterns and the habits that people have with the unconscious work. So then people can little by little open the options and understand that it's not always cause and effect. Like, for example, if I'm stressed, I need to drink wine. But we broaden the options and say, yes, you're stressed. And one of the options is drink wine. But then you can go for a walk. You can call a friend. You can bake a cake. You can go to the gym. You can, depending on what you like doing and you like doing with your free time, right? Or when you're stressed, how you like dealing with that stress. So we basically give the power to work on the unconscious mind and those habits, and then also we work on the conscious mind with journaling and education and like little readings and stuff like that, so then people can actually understand the patterns that they have and how they can actually change them or adapt them to the life that they want to have. Because as I always say, the if you understand and know and acknowledge your pattern, that is 50% of the work done. Because if you are honest with yourself, that is such a huge step that then it just goes easier from then. Like you can work on it once you acknowledge it as the first step, but it's necessary because if you don't accept it, if you're not honest with yourself, then you cannot work on that.
Being honest with yourself is totally the first step in anything. Like, why am I doing this? And what do I really want for myself? Not just what do I want, but like what do you really want for yourself? And you have to be honest. And then I'd follow up, which would go in hand with what you're saying is then what are you willing to do? Like, be honest. What are you willing to do to address this problem or fix this issue or whatever it is?
Definitely. And then there's where people are willing to do a lot and not people are not wanting to do that much. That's why we actually believe that the unconscious mind the work that we do with the unconscious mind, that we do it through hypnotherapy, can be very, very powerful and very helpful for these sort of people because without you realizing, your mind works. So you get there faster without you actually putting in the work. Because sometimes changing a habit solely on your willpower, it's possible. Some people have done it, obviously, but then when you see many people trying to change habits with their willpower and then they keep relapsing and going back to old habits. So actually rewiring the mind and opening the mind to new options, as I was saying before, with programs like hypnotherapy, is a very interesting option for these people that keep relapsing or keep having the problem to change their habits, because it's a new approach and it opens the mind, and it's definitely something to try because it's very, very interesting. I always say it's very powerful. And as I was saying before, people use pills or alcohol to numb themselves up because they give effects fast. Um, and maybe doing like changing something with willpower takes ages for some people, but doing it with hypnotherapy, for example, has results faster. Not in a day. It's not a pill. It's not a magic pill, but you might see results with I've talked to many people that have done the program and they've seen results in 10 days, in 12 days. So between 10 and 14 days, most of the people see the changes. So I believe that less than 2 weeks is very, very is a very short period of time to you for you to start seeing the results is very beneficial.
If anything, it's going to help, like you said, like people need help. And this is worth a try for me. I have some clients and followers that I personally think they should try this at least. I think it will be helpful, and not just in like kicking the habit of alcohol, but also in that kind of journey of self-discovery and
Hmm.
feeling like the difference and understanding their tendencies and what they do and don't like or want. And I think it is something that can help, which is why I wanted to speak to you, because it's all important for health.
Hmm.
And then hormones and sleep, like the whole it. I've been saying it a lot lately, trying to drive this home. I had a conversation with an amazing neuroscientist last week, and we were specifically discussing brain health. And I'm like, to be healthy, it's all the things. It's not just nutrition and exercise. It's like all the things. Everything you're doing in your day needs to be looked at, and also everything you're not doing in your day needs to be
Hmm.
looked at. It's not just like, again, nutrition and exercise. It's everything, which can be quite scary to think of it like that, but the body is everything. So we have to consider everything. So,
Hmm.
Sylvia, thank you for your time. This has been awesome. Lovely to see you again. Uh,
Yeah, I love to see you again. I really love the conversations that we have.
this one actually went a lot better with no interruptions. So I'll put all the links below and everything. I really hope this helps even one person.
Hmm.
It's an important topic, and I'll let you wrap it up with your few words in a minute. But my few words would be yes, there is a lot of talk right now coming out in the research and literature that we should just completely avoid alcohol. Like no amount of alcohol is okay. But that doesn't mean that that's completely relevant to you, because there is context. Alcohol is a poison, yes, but there's always context to be considered based on an individual basis.
Definitely, I couldn't agree more. And that's why, from unconscious moderation, we will never blame anybody that chooses moderation instead of quitting, because, well, it's actually in our name. Like, we help people moderate. We are not going to blame anybody. We're not going to demonize alcohol. There's so many things in life that we shouldn't do, quote unquote, because the word should is quite it's not very beneficial, really. But yeah, there's so many things that can be bad for our health, and we still do. um some people say choose your poison, right? And um obviously with moderation, everything with moderation, but we don't need to be like completely healthy in everything that we do and perfect, because I've seen many people that have tried to pursue that perfection, and then what they have is so much perfectionism and anxiety that they end up getting sick anyway. So again, choose what works for you and listen to yourself and learn about yourself and adapt your habits to what works and what doesn't work for you, because this is the key to understand yourself and to live a better life.
And we all have our reasons why we do certain things as well.
Exactly.
So,
Mhm.
thank you, Sylvia. This has been great. Lovely to see you again.